You can be directive to many of these AI generating document or, program or whatever kinds of things. But you have to, as you said, you have to really have a high understanding of where it's pulling from. You have to still be the director. It's kind of like the way that I tell people they have to use their insulin pumps. We have what many people refer to as smart pumps today, but you are still the person telling that pump what it should and should not do. You are setting the parameters for its use. And AI is really, it's the same concept. You can use it for gathering really good analytics and giving it your database and being able to say, can you pull more than what it's showing me out of this? Sure. But again, you really have to know what you're asking it, or it may step in and give you some things that I honestly consider like they could be biased. The accuracy
Yeah.
may not be right.
Welcome to Think Like a Pancreas, the podcast, where our goal is to keep you informed, inspired, and a little entertained on all things diabetes. The information contained in this program is based on the experience and opinions of the Integrated Diabetes Services clinical team. Please discuss any changes to your treatment plan with your personal healthcare provider before implementing.
Thanks so much for joining us. You're here with Alicia Downs, RN, MSN, CDCES, BCADM. That's a lot of letters here at Integrated Diabetes Services. I'm one of the nurses, and AI tech is a lot of my specialty. And I'm here with Jennifer Smith.
Hello, everybody. I am a very enjoyable conversation that we're going to have today. I'm excited to talk to Alicia about this. And I am an RD CDCES. I don't have as many letters as Alicia has. We all use AI an awful lot and get a lot of really good questions from people about, I think, the pros and cons specifically to using it within the realm of diabetes management. It's used for so many things in a very positive way, but I think you really do have to be careful within the realm of diabetes.
Yeah, AI is pervasive. It is everywhere. It's kind of a new thing in how we think of it today in this large language model AI that is creative and generative. That's generative AI that can take information, put it together, and pull something fresh out. But as long as we've had Google, if you're a little older, Ask Jeeves or
Right.
whatever, we've been using AI to find and aggregate data.
Information.
And that's really what AI is. And if you're on the internet, your information is being processed through AI constantly.
It is. It's the reason that we get the commercials for, you mentioned a specific brand of socks, and then you get a commercial for that brand of socks on the side of your screen the next time you log in or pull up a website or something, right?
Yeah.
I mean,
And it's even like, if you use, if you have Sirius radio, that's then linked to your personal information. And so now your music preferences and what things you skip and what things you want, that is being fed into databases and used to generate patterns so that things can be sort of tailored. So it's out there. We're not going to stop it.
no.
That's for sure. So what we want to do is really learn how to identify it and how to interact with it safely and effectively.
Especially
really
in the
Yes. Yeah. There's a lot of discussion right now over whether AI actors, AI bots, or AI platforms should be required to pass the licensing exams that the medical professionals in that space have to pass. So essentially, AI would have to pass the CDC and the nursing exam to be a diabetes education tool. I personally am a huge proponent of that. But it's still tricky because there are really two kinds of AI. There are kind that I call like AI in a box, where we take the technology, we put it in a closed space, and then we tell it only the information that we want it to use for decision making.
Correct.
Because right now, the AI that we think of in terms of like ChatGPT and
Yeah.
It's not in a box. It is
No.
large scale. It takes everything it can get from the internet and pulls it together. We can tell it to prioritize or
Mhm.
to preferentialize scholarly research
Correct.
or,
Yep.
official recognized associations and organizations. But that doesn't mean that, I mean, if 15, if 150 people on the think you should only eat marshmallows for diabetes management Facebook group start pumping out the information about how marshmallows are definitely going to cure diabetes, that AI is going to say, okay, there is an overwhelming amount of information on this.
Let's
It's
use
got to
this
be
as
true.
recommendations. It must be true,
Yeah.
right? Yep.
Yeah.
And
It
that's
doesn't know the difference between like urban myth and actual information and misinformation. And a
yeah.
lot of the space in diabetes, type 1 management, especially in peds, especially in women, we don't have the data. And
Right.
AI isn't programmed to come back and say, I don't know.
I
There's
just
no
don't
real good
know.
data there.
No,
It
like you
will
said, it
piece
just
one
goes to
together.
resources and it looks.
Yeah.
And it pulls, as you said, what's gotten the most clicks or the most hits or the most discussion online in all of the platforms that are, there to grab some statement or some information from. I mean, in the realm of, I think, the way that we often in our, clinical space see people using AI, as you talk about, like the AI in a box is a lot of the algorithms that we have driving our systems today, right? It's I give you this information, this data, these constraints of a ratio, reference point,
Yes.
target, and the algorithm can then navigate within the constraints we've given it. But when we start using the online plat in a way to maybe improve our glycemic control or automate some of our counting skills or some of that kind of stuff, that's where the line gets kind of gray because, again, you're no longer just in your box that's written a certain way. Now you are asking for all of the reference, as you very well said. Some of them might be something that the random person on, who knows, Easter Island made a note about, like you said, eating rocks. And gosh, that's really good. And my blood sugar doesn't go up or whatever.
Right. And all they have to do is often put that, well, this is from Dr. So and so's website. That could be a doctor of philosophy. Doesn't make them an MD.
No.
But again, there are a lot of tricky things. That's one space where knowing the source of the AI is at a high level very
Mhm.
helpful. If you are going to start using AI in a big way, and let's face it, most people who are going to be using AI with a lot of purpose, really digging into it, pretty high tech acumen,
Right.
but understanding what are the biases of this system. Some systems
Mhm.
will bias toward very scholarly information, might be completely useless in the day to day. Others will bias very much toward pop culture and what's
Mhm.
popular and those references. Some will skew very much toward just the news and
Right.
using sort of traditional media outlets as their priority sources.
Right.
And knowing that because we pass on our biases to the systems that we build.
100%.
And
All the
so,
questions that you ask while you're asking, hey,
yeah,
ChatGPT, for example, you can put in, could you help me put together this statement on such and such an idea? And it gives you something, but then you tell it, but I really want you to go in this direction. And then
right.
you ask it to do more. Could you put a chart together that's got a little bit of this type of information in it? You can be directive to many of these AI generating document or, program or whatever kinds of things. But you have to, as you said, you have to really have a high understanding of where it's pulling from. You have to still be the director. It's kind of like the way that I tell people they have to use their insulin pumps. We have what many people refer to as smart pumps today, but you are still the person telling that pump what it should and should not do. You are setting the parameters for its use. And AI is really, it's the same concept. You can use it for gathering really good analytics and giving it your database and being able to say, can you pull more than what it's showing me out of this? Sure. But again, you really have to know what you're asking it, or it may step in and give you some things that I honestly consider like they could be biased. The accuracy
Yeah.
may not be right.
Yeah. AI is all driven when we directly interact with it by prompts. So
Yeah.
if you're using a, a Gemini or a Chat GPT kind of prompt driven, very language based. And that's
Hmm.
the AI that most consumers are interacting with is a language based model. Really keeping an eye on your prompts, knowing that how you ask your question can very much skew the answer that you get. For example, if I feed in, well, first of all, I have to feed in my data. The
Right.
thing only knows what I tell it to know. So
Right.
I can't say my A1C is 7.2. How can I make it better? It's
Right.
going to be like, take your meds and see your doctor, like the stuff that you really do know.
Correct. Yeah.
But so I have to tell it, here's what I'm eating, here's how I'm using my insulin, here's how I'm taking my medications, but it still doesn't know any of the human factor.
No,
It
and that's
doesn't know
fantastic
that I
you
exercised, that I really hate Monday mornings, that I took my insulin late this day, that I had a sight problem on that day. You have to really give it a lot of information. Like the logs
Right.
you hand your doctor will get you into a mess with ChatGPT
Hmm.
because you have to give it so much for it to give you any sort of accurate or specific response in any way.
Correct. Yeah.
Otherwise, you
You nailed it.
really just default. It just defaults back to, ADA guidelines. Yeah, you can get that from a pamphlet at your endo's office. You don't need to
Yeah.
go to ChatGPT for it. It really is the basic stuff.
Yeah.
If you are going to feed in a lot of info, then you have to know that the prompt and how you ask it informs a lot. For example,
Mhm.
if I'm talking to Jenny and I say, Jenny, can you tell me all of the reasons that Hershey's chocolate sucks? She's gonna say, I mean, I guess it's not the best. I prefer this, but it is good. She's gonna give me some pushback
Right.
because she's a person and
Right.
people are inherently wired to communicate, but not necessarily pander unless
And it
they're
depends who you're
unethical.
talking to on that personal level too, right?
Right.
You're asking the question to me. I'm a registered dietitian. I do have an understanding of food and nutrients and how to read a label for ingredients. And so I could give you a heck of a lot of unbiased. This is why Hershey's
Right.
chocolate, for example, or Cadbury or whichever one, right? We're not beating up Hershey here. But
It's the
but
only
it
one I
really
know.
is just I have not only personality behind it in terms of how I talk about it, but I've also got experience and education behind it. AI doesn't
But
have
you
that.
and AI doesn't hear what you're not asking.
Right.
Why does it suck? Because your blood sugar goes to 240 every time you eat it because your carb ratios are wrong and you're not pre-bolusing. And
Right.
mostly you eat chocolate when you're really stressed out or PMSing. So those are
Right.
probably also, so all of that context is gone. And I
Mhm.
also point out that AI is designed to sell things.
Mm,
It is a product used by companies to sell things to us. Good
sure.
rule of thumb. If you're ever not paying for something, you are the something. You are the product. If
Mhm.
you're using ChatGPT or Gemini or any of these sort of free processes, you're the product. You're the
Mhm.
thing that they're making money off of now. So they want you happy. They want you engaged. They want you to keep talking to me, keep talking to ChatGPT, stay on your computer for 3 hours going down this rabbit hole. Absolutely. So they're going to be predisposed to agree with you and
Mhm.
to prove that you and what you are doing is right. They're
Right.
very, very affirmational. I
Yes.
can put some really unhealthy behaviors into my chat GPT, into my AI and run it and ask them, how am I doing? And it's going to be like, oh my gosh, you did 14 finger sticks last night. That is really great diabetes management. That's keep up the great work.
Right.
No, I did 14
When
finger
really,
sticks
no.
and when I was supposed to be sleeping. Like a
Right.
human will see that and push
Correct.
back.
Yeah.
AI won't. AI
And
will
what
say,
kind of
"It looks
human
like
though?
your diet is really low carb." Yeah,
Mhm.
because I eat primarily bacon. That's not great.
No.
Oh, look, you've lost 15 pounds. Yeah, because I don't take my insulin. So it's not going to push back. And as a medical professional, a
We do that.
large part, yeah, our job
Mhm.
is often to tell you where you're wrong or where you're making mistakes or where your thinking is in error.
Yeah.
Because let's face it, if you were doing everything right and everything was great, we wouldn't be talking. Nobody comes
Correct.
to a diabetes educator, to a nurse, to a dietitian because everything is great in their world and they're
Everything's
amazing and they just want to
correct.
talk about how amazing it is.
Right.
And so if you're working with a system that's like, you're right.
Mhm.
Yes,
Yeah,
absolutely.
the lack of human interaction, I think, is a huge con, or it's a major drawback to utilizing these. Like you said, if you're online trying to really kind of filter out what's been going on for you, you're very likely to get a lot more from an unbiased human interaction who can look at your data and see it as data, but then ask you questions about particular points, especially most recent history, right? Not 3 months
Mhm.
ago, because none of us, I mean, we have diabetes too. We get it. Like, don't ask me what happened 3 weeks ago at noon. I have no clue, no idea, unless I kept a note someplace. Maybe I could tell you, but we understand that as we work with people and look at their data and we look at more recent information. We say, well, we established this. We've been working on this. This looks a lot better. I see that your bike ride in the afternoon, gosh, you've been really putting into action the whole idea about insulin adjustment and maybe a snack or not a snack or whatever. Whereas AI doesn't know any of that unless you feed it your book of notes
Yeah.
about every date. And I think it's honestly, to some degree, a bit better to talk to somebody about it to get that ability to have a back and forth discussion, which you can't really have with AI. So,
AI sees everyone as this homogenous group,
oh
right?
yes,
So it is an
as it's
algorithm.
supposed to. It's an algorithm.
Yeah. And the problem there is that its only point of reference for your diabetes management is the homogenized block of information. On two sides, that's a problem right now. One is there's not a lot.
Right.
It's not like there are billions of people with type 1 diabetes feeding their information and asking AI what to do about it. So AI is very limited in its experience. But on the other side, in that block of humanity, are totally inappropriate comparison. I
Mhm.
should not be looking at the data of a 72-year-old man who's had diabetes for 50 years and comparing that to a 22-year-old
Right.
woman who just got diagnosed last month. Wildly, your eyes should expect to see different things. And that's where a diabetes educator who puts together the data they're seeing, the individual that they're talking to, and
Personalization too.
my experience
Mhm.
of what does being this person often look like. When I see blood sugars that doing this, what does it tell me about the individual and their all of that is lost in AI
It
unless
is.
you have a very long-term engaged relationship with your AI. But again, the longer you do that, the longer it skews toward your personal
Your
biases.
correct. That's where, as we work with clients that we've worked with, and we know them, we know their dog's name, we know when they take their dog out, right? I mean, we get
Yeah.
to really know the clients that we work with, and in our communication with them in visits, and even in emailing back to them, we have an idea about what has gone into their data. And they may also give us more reference. Hey, last week, I was on vacation, so kind of look at it for maybe for reference for next vacation, but not for the overall picture of adjustment,
Yeah.
right? I mean,
Yeah.
and that's some of the what you really have to consider with AI. I think using it for the right reasons, and there are even pros and cons to what somebody might consider right. There's a big discussion, in our
Yeah.
wonderful online diabetes community all about using AI just for carb counting right now. There's a huge discussion all about it because it's a wonderful way to be able to snap a picture of what's sitting on your plate, ask ChatGPT or whichever one, Gemini, whatever you're using, and say, hey, what are the macronutrients in this plate full of, 2 cups worth of this food? And AI can generate back an idea. But there are some interesting, more developer minded people who've actually gone and fed it the same picture many, many, many times, and you get a different result every time you feed it. So I think therein lies just one good example that could you use it to your advantage? You could. But the more you feed it, and I've tried it, I'm sure you have as well played with feeding it some information, a picture, and I say, here's my plate. Tell me what the carbs are. And I only ate half of this. And the portion that I ate was the size of about a softball. Or I didn't eat the sauce that looks like it's on the side of this plate. Again, you have to be very directive to actually get it to give you the right information for you to use. And when we're talking about diabetes and using it for something like carb counting, we're talking about dosing insulin here, right? Which we all kind of take the order from the doctor and we go and we do our own adjustments to things. And hopefully you're working with somebody who's helping you with that and you have some understanding of insulin action. But we all titrate, I think is the better word. We all titrate our insulin. And in order to be able to do that along with what you're asking AI to provide some reference to use that insulin appropriately and to use the algorithm within your pumping system, for example, you have to give it a lot of direction or it's going to give you different answers 6 times in a row. And that's frustrating.
It's frustrating and potentially harmful because
Correct.
depending on the day that you ask, you could get a very different answer. I actually work in training and quality assurance of AI.
Mm-hmm.
That's can it be safe? Can it be safe and effective? Can it be as effective as a clinician? And AI is learning at exponential rates, but there are things it is really good at, and there are things it will mess up almost every time. But
Mm-hmm.
what's really scary is that it'll mess up in a different way.
Yeah.
So it's not like I can go like, AI is always off like this by this much.
That's not true.
I have literally fed it information and said, do this analysis. And it says, here you go. And I say, based on that analysis, what are recommendation? And it says, here you go. And I will go an hour later, clear the chat, clear the prompt, same AI, same question, same data, different answers.
Yep.
Oh, because now it has pulled something in the algorithm, just changed by
Slightly.
the slightest mint. It's when you're talking to your educator and your educator is off by this much, your educator is really close to you. So that's a very small margin of error.
Yes.
AI is off by this much, but it is 900 miles away from you.
Mhm.
So this much as you go out now is now very far. So now the margin of error is
Gets bigger.
considerably larger.
Right. Yeah.
So really keeping that in mind, AI is really good for finding patterns
Yes.
or letting us know if it is a pattern.
Think Like a Pancreas, the podcast, is brought to you by Integrated Diabetes Services, where experience meets expertise, passion meets compassion, and diabetes care is personal because we live it too. Our team of clinicians, all living with type 1 diabetes, understands the challenges firsthand. We're here to help no matter where you are in the world. From glucose management to self-care strategies, the latest tech, sports and exercise, weight loss, type 1 pregnancy, and emotional well-being, we've got you covered. We offer consultations in English and Spanish via phone, video chat, email, and text. Want to learn more? Visit integrateddiabetes.com or email info@integrateddiabetes.com to schedule a consultation.
But you also have to let it know. Analyze this pump data from this pump on this software version, because otherwise it's just, I'm just analyzing lines and here's what the lines tell me, but it doesn't know what those lines mean. So really educating the system on here, use this data only. It's from this system, from this date to this date, because if you put dates on there you don't want to see, it's going to use those. Here's what these notes mean. Correlate that to this data, what I ate, my exercise, where I went, whatever you're trying to find in your pattern, and say, are there list observable patterns and their correlations across these sets of data? Or it is my hypothesis that there may be a correlation between this and this. There may be a correlation between the fat content of my meals and elevated blood sugars. Is that accurate per this data? And then let it give you as honest a response as it possibly can. Show me, and you can also ask it, show me the percentage of likely accuracy of the statement. So it might say, yes, there is a visible pattern. And then you look and it says, 33% of the time this happens.
Right.
33% of the time is not enough to say that was the cause. There's a
Correct.
correlation, but not a cause.
But not a cause, right?
I always tell patients, if something doesn't happen more than 50% of the time,
Right.
it's not causal. It might be
Right.
correlative, might have something to do with it, but it's not your cause.
And as you're feeding it data, and I think of kids that we work with, and I also think a lot about people who have variable schedules, right? We've got multiple children that I work with who have very different schedules through the course of the week. Sometimes on Tuesdays and Thursdays, they've got gym at 9 o'clock in the morning. And on Mondays, Wednesdays, and Fridays, they've got art or they've got math or they've got something that isn't in that space. Well, again, as you were saying, if you don't give a schedule of information to the data, then it's also not going to pull out a trend for you. It's going to say, I don't see any trends, or I see this happening on these days. I'm not sure why, right? I mean, it's not going to say I'm not sure why, but really in the background, AI is probably like, I don't have any idea why this person's, whatever. I'm giving it a personality that it doesn't have. But if I imagined, having a personality as AI.
Anthropomorphizing is like
Correct.
the doom of tech talk, but it is
Right.
the easiest way to communicate it.
It is, absolutely, because we can't take our human out of ourselves, right? We can't take the way that we think out of it. But as educators, like I said before, we have that person's schedule in mind. We have that child's schedule in mind. We know that at 10 o'clock in the morning on Saturdays, they go to a tournament for 2.5 or 3 hours. And we've helped them then assess a pattern around that particular day to kind of figure out a plan of action. And so I think what I'm kind of trying to get at is feeding it more and more and more information could get you an end result that's close to information you could use. But do you see how much you have to feed it? You see how many notes you actually, it's, in my opinion, many times getting the right answer out of AI, especially for diabetes management and trend and pattern and adjustment ideas, you might as well just keep some notes and talk to your educator about it, is my honest,
Well, and you don't know, we are gifted with knowing the right answer going in. So we can look at the answers and assess whether the answer is right. If I
Correct.
don't know the right answer going in, how do I know that the answer I get is right? I need to know the logic behind how did it make this decision? What are the references that it's pulling from? Oh, 3 of these 5 references are from keto dieting groups. It's not going to work for me. I'm a carbaholic. No, now it's completely useless referencing. So really having it, you have to be smarter than the system that you're using to know if it's right, which is a big margin of error. So getting information from AI is a great first step. Then use that as a way to communicate with your clinicians. I
100%.
love running my data through AI, asking it to spot patterns. I always tell patients, if you want to spot patterns, list your symptoms. I have headaches at this time. I get really sluggish at this time in the afternoon, And then say, do you see any patterns that correlate to blood
in
sugar
my data
or diet or so forth in this data? And now I can go to my doctor and say, by the numbers, 72% of the time when I do this, I feel like this, or I get this outcome. Explain to me why, and can we look and see the variables? Because very often also it's in what you didn't put in the data. That we as clinicians kind of get to learn. I credit the TV show House with getting A's in nursing school, and House would always say, the patient always lies. And that's not saying we lie when we go to see the doctor. What it's getting at is that as a physician, in order to make the best decision and recommendation, I often am having to look at what you didn't say.
Tell me.
What did you leave out? What are the spaces you're not filling in that probably go right here? Because that's why we do a big long assessment and then a 90-minute intake.
Correct.
If I didn't need to fill in all the holes, I would just have everybody do a 2-hour long assessment and talk to no one.
And
feed all of that through a computer and then throw them. I would just be a data center.
Well, and I think you're right. And think of that in terms of you're feeding something that doesn't really have a human personality to it. It doesn't have that at this point. I often look at AI kind of like, and I don't mean this meanly, but I tell a lot of people who complain when they come to us that their endocrinologist is not an educator. However, many people go to their endocrine clinic expecting to get education on my data looks like this. Can you tell me what happened? Can you tell me how to, like, what's the behind the scenes? What's the physiology? What's driving this? What's happening? We as educators put that piece in. We look at the data together. We ask, what's your life like? And we put in parameters that they can then look at their own data and understand why they can now see a pattern. And oh, I get that. Like you can put two and two together and gosh, it adds up. AI isn't an educator. You can ask it to tell you about something. You can ask it to tell you if there are trends or if there's a pattern or something's happening, but it's not going to give you the behind the scenes. And I see this happening. You should try to do this. Back up your insulin here. Use a snack here, unless you ask it more and more and more.
That's the specificity is,
Mhm.
again, you have to remember how far you are from the AI. That
Yes.
range of error, that margin of error gets larger and larger. Because of that, I always compare it to the Dexcom Clarity reports. If someone's a Dexcom Clarity user, we all know we got so excited when we got data for the first time, and then we clicked where it says patterns.
Yeah.
And it's like, you have a pattern of low blood sugar at 3 PM. And I'm like, yeah, I know.
Thanks so
That's why
much.
I'm wearing the Dexcom, because I don't want to die at 3 o'clock. Oh, you have a pattern of overnight highs. I
Yep, I'm
know. I've
aware.
peed twice, like all night. Like it's every night I have to pee twice because high blood sugar. But what it can't do is say the why and the
What to
what you
do
should do
about it.
about it. And when it does make those recommendations, best case scenario, it's making them based off of ADA standards and what's in the textbooks.
100%.
Anybody never notice that your endo goes in and tweaks your basal by like 5% and your
And it
carb
does.
ratio by 10% and hasn't touched your correction factors since you started using the
Forever.
system?
Correct. I know that poor correction
Right.
factor. It's like the stepchild in the corner, like doesn't get fed, right? It never gets
Or your doctor just goes in and does like the rule of 1500 or the rule of 1700 and just does the math on it and plugs it in.
right.
And so you're going to get that level of adjustment, but even lower, that even more conservative, because it also has a litigious bend of, it can't actually medically recommend. And so it's going to say like, I recommend you change the timing of your breakfast bolus. You're like,
Mhm.
yeah. And it's going to like,
Right.
try to take that bolus sooner. What, like
What does
3
that mean?
minutes sooner or like yesterday? Like, yeah, the
When?
specifics are going to be missing. And when they are there, they are going to be typically so small as to make little to no difference.
Correct.
And then it's actually reinforcing the unhealthy biases that we have in our management. We often cannot see our own world clearly. So it's going to say, try to take that bolus sooner. I'm going to take it 5 minutes sooner when I should have taken it 20 minutes sooner, but I'm going to take it 5 minutes sooner. And one time my blood sugars are going to be better. Or I just feel better about it because now I've done something.
Right.
And so I say like, oh, AI was right. No, AI just said a thing and made you feel better. And so now you see the data differently. You don't respond to the high as much. You don't respond. Or you then start having problems after that because you asked it to fix the high. You didn't say anything about what's going to happen on the other side or that delayed rise later.
Right.
And so it didn't address that because it wasn't asked. So now this problem gets better, but this one gets worse. So now you say, go tell me how to fix this second problem. AI does not recognize that it's related to the fix for the first problem.
Right.
And
Again,
so
it
you
goes
start
back
getting
to
layer on
saying-
layer of like convoluted suggestions.
Yeah.
that just start
Absolutely.
working against each other a lot.
And
You're
along with
suspending
it
to
goes,
stop over here, you're increasing doses over here, you're stopping over here, you're increasing over here. It's a sum zero.
and if the system doesn't know what type of an algorithm you might be using or what
Yeah.
your strategy is or any of the if this then that kind of scenarios that you have going in your life, every single algorithm is very different. It truly is. It's the reason that coming from one system to another, you have to always expect to make adjustments. Your settings are going to they're going to shift and change. But if you can't or don't know to give that to the system, and the system pulls from who knows where, instead of pulling from Tandem's information, it pulls from some long line of discussion online about a Tandem pump, and that's where it gets its information about the algorithm, you're probably going to get incorrect information for making adjustments for what you told it was your system, right?
Yeah, that's the misinformation about how our systems work, how our insulin works, how our bodies work is vast, vast,
Mhm.
vast, vast. If you would like a proof of concept, do a search on brittle diabetes. And for listeners, I just put that in air
Favorite
quotes
favorite
because
term.
it is not
It's
actual
not a thing.
physiologic thing. It is not a diagnosis that you can
Nope.
have. It is related to insulin timing, absorption, dosage. There are a lot of factors that
It's related to incorrect
rapid
education
changes. Right.
entirely. Yeah.
But if I go in and I'm like, okay, what do these sudden drops indicate? I could very easily say, it looks like you have brittle diabetes.
Right.
And then there are litanies of pseudoscience out there about people who have brittle diabetes and what they
Yeah.
did to make it better or what made it worse or how their doctor told them this or that or the other, because doctors are just susceptible to misinformation. So then what they feed in to our information stream becomes misinformational. The common saying is that what we understand is science and what we don't understand is magic. And then if it's magic until we understand it and then we shift it over.
Right.
Well, in our modern times, when we're using technology, what we understand is math. What we
Mhm.
don't understand is learning. And so the minute people come across something about the algorithm or the trigonometry or the calculus or the any of how these systems integrate and use information, they say it's learning, when in actuality, it's just working with a data set
It is. It's
and
adapting is
understanding
a
that.
better word.
And even the adaptation
Mhm.
is
It's still
going to
based
be
on
very specific.
it's based on
It's going,
rules.
yeah, it's going to be very limited, very repeatable, very predictable. You're going to be able to say, if this, then that.
Yes.
Not like, I don't know, it's going to learn. We have one system that dynamically adapts, but even then in a very, very predictable way.
In a predictable way, because it's still
Yeah.
based on a written algorithm that has
Yeah.
rules that drive it.
Yeah. So AI, fantastic for prepping for appointments, for finding the right questions to ask, for getting us out of our own way, if we're very honest
Yep.
and say, do you see patterns between my behaviors and what you're
Yep.
seeing, and asking specific questions with a lot of data. It's
Mhm.
really good for IDing patterns
Mhm.
as correlation, but not causation. So you'll be able to see that a lot of the time, and again, ask it for percents. How often is this
Yeah.
pattern here? This amount of time, this happens together. But then don't take that as causation. Take it deeper. What is the
Right.
physiology behind it? What is the psychology behind it? What is the pharmacology behind it? What is the
Right.
technology behind it?
And what's
and
your life behind it, right? Something that
right,
comes up as happening 15% of the time. Well, maybe it's because it's every Saturday at a very short amount of time, but there's something specific happening. And again, that's where giving the system more and more information, it can say, this is happening this percent, but it's only happening on this day within this time period, which you told me you were doing this here and now. So something needs to adjust here, but not all the other days at this time, right? That's where we need to be able to direct it to go if we're asking it to truly give us direction in change. And at this point, I mean, my whole summation is it's great for a lot of things, but from an angle of education and true discussion through your life and how to make it work for you, you really should be coming to a clinician for that. So
if you're using a diabetes app that claims to have AI coaching, algorithms to analyze, and so forth, first know that, like I said, if you're not paying for it, you're the product they're making money off of. If you are paying for it, you should be able to ask them, where does it get the information? Where is it referencing? It should say, these are the quality assurance measures that we take. It's reviewed by, there should be actual people in that loop who know when the machine's going wrong. Also know that it is going to be the basic food analysis. It's going to stick to food. It's not going to consider hormones and other diagnoses and alternate meds.
Nope.
Also be very aware in the diabetes space that wherever you're asking questions that have crossover between type 1 and type 2 or type 3C and type 2, the amount and popularity of the type 2 data is massive. It's more than 50% of the population of the United States. So your information is often going to skew that way, which is not terribly helpful or potentially harmful when you're also a type 1, also an insulin user, also have no pancreatic function and so forth. Keep an eye out for if you are using a system that uses some form of coaching. I recently signed up for a system that was supposed to be for mental health and behavioral and habit change. That could be great to help my diabetes world too. I started talking to the coaching, and the coaching was so affirmational. It was so like, go you, rah, rah, sis, boom, bah.
With no real constructive feedback that's like, this was better, but I see that you're still struggling here, or pointing out where you could actually be addressing something. I mean, you need systems that are going to have both the friendly person and the person who's like, put on the big girl pants and like,
you should be getting really even. If you're not getting at least even amounts, good cop, bad cop, you're talking to an AI bot. Not a person, not a coach. There is no actual human involved in that interaction. Again, a clinician's job is to help you grow, help you get stronger, help you learn and make progress. And that often doesn't make you super thrilled. You know, the first thought should be, or that's going to be hard, or that's going to require me to change. It's supposed to. That's the whole reason that you're seeking help. Because if it was just affirmational, you could put a happy Post-it on your pump or on your bathroom mirror and you'd be fine.
100%.
So really being on the lookout for those things that let you know, okay, this is a predisposed system, and the system's primary goal is to keep me connected and happy. Not change. Change. I always say, if you've got a physical therapist and your physical therapist you don't kind of want to cuss them out, they're not doing their job. You should kind of hate them, but you should also make progress.
Correct.
So if
and
you
AI
love your AI and it gives you the warm fuzzies, probably not going to get the progress you need.
Good.
And when in doubt, run it by your clinician.
That's right. Absolutely. That's what we are here for. Integrated Diabetes has a whole number of clinicians, all with different background and different ability to help you navigate. And certainly AI, we're all very good at some aspect of AI, since we also use it, live it, and you can reach out at any point. And this was awesome. Thanks, Alicia.
Thanks, Jenny.
Thanks for tuning in to Think Like a Pancreas, the podcast. If you enjoyed today's episode, don't forget to like, follow, or subscribe on your favorite podcast app. On behalf of Think Like a Pancreas, the podcast, I'm Gary Shiner, wishing you a fantastic week ahead. And don't forget to think like a pancreas.